Okay, hello everyone. I have another wonderful expert interview for you today. I am so excited for this one. Dr. Susie Gronski is a physical therapist, and she is somebody that I've never met in person, but I feel like we're best friends. I feel like before I got on air here, I started by saying I just want to give you a hug because I just feel like I know her. So she and I are very, very similar, and I'm going to let Susie introduce herself, other than I'll just say that she is a licensed doctor of physical therapy and a board certified pelvic rehabilitation practitioner. And simply put, she is the doctor for everything down there. And so I also want to just share with people that I think Susie is pretty open with the words that she uses, and I am too, but we're probably going to use some technical anatomical words. So if you are uncomfortable with that, or if you have little ones around and for some reason you don't want them to hear it, then maybe put earbuds on or don't watch. So anyway, I'm going to go ahead and turn it over to you, Susie. And I want you to, introduce yourself, tell us about you. And also, I'm really curious to know, have you always been this open with talking about the human body and, that kind of thing, or is this new for you?
Thank you so much, Brie. I love that wonderful introduction. You're so much fun. And, likewise, I feel so connected with you, and I'm very happy that you have me on your show. Thank you very much. So you did it. You said it right. I am the physiotherapist for your private parts, a doctor of physical therapy. I've been practicing PT for it's going on 8 years almost, and I've been doing pelvic health for the past 6 years, focusing on actually men's health for the past 3 years. So most of my clientele are male-based, but I do treat females who have pelvic pain as well. I myself actually got into the profession because, one, I was jumping on the trampoline in my early 20s and just pissed all over myself. And it was and at first I was like, wait, that can't be sweat. That's not sweat. I run to the bathroom and I'm like, yeah, that's not sweat. That's pee. Yeah. So I decided to do a little investigating. My really good friend Ashley back from home, actually from Chicago. I'm actually in Asheville right now, but originally from Chicago. She sent me a little thing saying, oh, there's this pelvic health specialist up in the suburbs. She's doing this internship. I think you'd be interested. And I was like, how did you know that I peed my pants?
She just randomly connected with you.
Yes.
Oh, that's so interesting. What happenstance? That's great.
I know. And so I shadowed this lady and I fell in love. She did visceral work and she did pelvic health work. And I was like, oh my God, I love it. And ever since then, I was hooked. So I took a lot of my classes with Herman and Wallace. I became certified through them and also board certified through the APTA, which is the American Physical Therapy Association. And I've been practicing pelvic health ever since. And pelvic pain has really just come into my life. I mean, I've actually have bladder-like symptoms, UTI-like symptoms that I've suffered in the past. Didn't know what it was, but now I have more wisdom to figure out that it's actually my pelvic floor, and that's why the incontinence issue was a troublesome, because I had overactive pelvic floor muscles that were irritating my urethra. And so you learn a lot about your body, and you learn that the more that you learn about yourself, the better that you can help your clients. And so that's how it all started for me. And it's always an excitement. It's never a dull moment. And changing lives is just great. It's great.
That's awesome. Yeah. So, and today we're going to talk about actually tips for pelvic pain that you can do at home. And we're also going to talk a little bit, and by the way, this is for men and women today, this conversation. And we're also going to talk a little bit about what to expect when you do see a physical therapist, if you see a physical therapist. So That's what we'll chat about. But again, I want to go back. So it sounds like, this certainly wasn't something you were 3 years old and saying, I want to be a women's health physical therapist. So were you always, it kind of came into your life as an adult, so were you always so open about these topics?
Oh, yeah, actually, I have. I grew up, my family is Polish. They're like crazy, open Polish people, I like to say. There was definitely talk about sex and poop and pee, very, very open. So I feel like a lot of my comfort with body parts and body fluids and all that sort of thing, it came from my upbringing. We were never shy. And so
I think that you're lucky. I think that's really, really lucky. I'd say my growing up experience was actually not like, well, we talked about jokingly about certain things like farts and poop and that kind of thing. But we were much less open about like menstruation and I don't know, just woman things and sex. That was definitely not really discussed, and so I think you're really lucky. And actually we had never really referred to private parts by their technical terms or really anything other than sort of in an embarrassed fashion. And I'm actually speaking about my mom was sort of like that. And so I actually really had to work on using the proper terms when I started my work as a women's health physical therapist. So I remember spending, like sessions in the car with my husband just saying, okay, vagina, vagina, just saying it so I could get used to like how it sounded in my mouth, like how it sounded coming out of me. Yeah. And I don't know, it's great, I think, to have from an early age just a really open conversation in your family around this stuff. So anyway, that's a little sidetrack note. Well, let's go ahead and get right into the topic today, which is pelvic pain and your top tips that men and women who are experiencing pelvic pain can do at home. And maybe we should take a teeny back up and talk about a few basic reasons why people might be experiencing pelvic pain in the first place.
Good question. And this is a very broad, I would say, explanation. There's so many things why, well, first of all, how pain kind of enters our life. And it starts off with the question of what others define pain as. It's very subjective. So you can have emotional or psychological issues that contribute to physiological pain, meaning they just manifest in the body as a response, right? And it's usually over time. When the patterns that I'm seeing now with all my clients, both men and women, are that it doesn't happen overnight, although it might seem like that at the moment, because all of a sudden everything's fine and you wake up and all of a sudden you have this pain, and it's this freaky, first of all, because it's your genitals. It's not like a hamstring or a bicep, you injured your bicep or something like that. It's your private parts. And so there's a lot of stigma around private parts and social constructs that I think are ingrained at a very early age. And so it creates more fear. And the fear that consistently perpetuates in someone about this part of their body actually contributes to the painful response that they're getting. So to answer that in a short way, it could be a tissue issue, or it's not always the issues in the tissues. So for women, for example, like having a vaginal delivery and having an episiotomy or a tear, right? Scar tissue. It could be trauma, sexual, emotional trauma as a child or into young adulthood or whenever, can be very perpetuating. And literature has been shown for women, especially if they've had sexual trauma in the past, that they're more likely or more predisposed to have pelvic pain or pelvic dysfunction in later years.
And unfortunately, it's so common. It's so common. So I just had to throw that in. So yeah.
No, totally. It's as common as like asthma, a cold, and that's, I think, a big point to bring home is saying, pelvic pain exists. It's common. You're not alone. And I think having more resources like what you're doing, Bri, and what you're doing with your show, and other therapists who are really, driving this message out through social media and other avenues, is just creating a certain safety aspect around it and support, which I think a lot of men and women really desire and need to overcome pelvic pain in general. So yes, it could be some sort of trauma. Like for men, sometimes it's a groin injury from hockey, it's a very physical contact kind of sport, groin injuries, groin pulls, that sort of thing, that can predispose someone to having pelvic floor dysfunction. And most commonly, pelvic pain is an overactive or tight pelvic floor phenomenon. Mm-hmm. And so, again, it's just over time that the body just says, you have to pay attention to me. And it could be diet, it could be lifestyle, like, sugar and inflammation in your body. Some people might get a migraine or headache. Other people have a headache in their pelvis. No pun intended. That's a reference to a book, actually.
Yeah, that's a great book. I like that.
Yeah, it's a great book.
Mm-hmm.
So, many, many different things. Abdominal pain, digestive disorders such as Crohn's or IBS also predispose. There's not a direct correlation, but they're saying that there's a commonality with if someone has digestive disorders, most likely they're going to also experience some pelvic floor dysfunction and vice versa.
Well, everything is so connected in the body. Everything is literally, physically so close together in that area for the irritable bowel syndrome or the Crohn's disease and the pelvic floor issues, or even maybe interstitial cystitis, the bladder issue and the pelvic floor. So that makes a lot of sense. I love that, but I love also that you're bringing in the connection of the brain and the tissue. So it's not that you're saying that it's in your head; it's just in your head, but there is an emotional component to this physiological condition. So it's
absolutely,
it's amazing how connected we are. So
yeah, it is. And I'm so glad that you brought up the point that, it's all in my head, because a lot of my patients and clients will oftentimes tell me that people they're not recognizing that I'm actually feeling physical pain, and they're 100%, they'll always tell me, I feel like I'm not listened to. I feel like I'm not taken seriously, that my condition is not taken seriously, that most people will wash their hands of trying to help me. And sad, although true and sad, I feel like, no one is out there just to spite people. I feel like everyone who's coming in contact with these individuals that have pelvic pain are doing what they know and the tools that they have to help support these people. But oftentimes there's a plateau and a block, and that's where I think it fails. Like conventional medicine will fail these individuals who suffer from pelvic pain.
Yeah, I agree. It breaks my heart. So what are a few of your top tips then for, I think we're going the more route of pain, usually due to overactive, tight, tense pelvic floor muscles. What would you suggest that people can do if they're like, I don't really maybe have a physical therapist in my area, or I just want to try something at home like right now because I hurt? What do you think?
Oh, I love this question. So cut me off if I go too long, because you said 5 or couple, and I'm like, there's so many. So first things first, and you talked about the brain and the body, I think it's just recognizing. And so I like to call this the RRE. It's recognize, reduce, and eliminate. I feel like with pelvic pain, oftentimes we need to recognize our triggers. Recognize whether it's a physical trigger, an environmental trigger, an emotional trigger, a person, place, or thing trigger, a smell. I think that if we can identify situations that create tension in our body, we can we can control our body better by knowing what situations put us in a bad state of mind, or our physical body just reacting and then creating more inflammation. So I think step 1 is recognizing what your triggers are. Where are they coming from? Step 2 is, okay, let's try to reduce these triggers. And some things to help with that is incorporating either diaphragmatic breathing, so like a focused, single-pointed breathing technique that will help reduce sympathetic regulation, which is the fight or flight response in the body, which creates tension and then diverts blood away from tissues like your reproductive organs and your gut to like your heart and your lungs and the bigger muscles, right? That's just fight or flight. So to downregulate sympathetic and upregulate your parasympathetic, which is the rest and digest, and it calms down the body and releases tension. So I think a meditation or a mindfulness-based stress reduction training kind of thing is very important, and applying it, not just doing it, but not making it a chore, but applying it during those times where you have triggers, or you feel your body just getting tense and tight. For example, you're talking on the phone with your boss and they're just annoying you, right? It happens. Pay attention to what your body's doing, and then use techniques such as diaphragmatic breathing to really ground you and just be able to release and relax tense muscles.
That's great.
So
I was going to ask you if you had like a real life example of that. That's a really good one. So it's like you're at work, you're starting to feel that stress and tension because you're feeling under the wire of pressure and your boss and whatever, and you can feel everything tensing up, and then you just stop. So how do you cue people to remember to do that? Because I know sometimes when you're in the moment, when you're in the thick of it, you're not always wanting to or remembering. Do you have a technique for that?
Honestly, if you want to practice breathing or grounding yourself on a regular basis, they have apps like the Breathe app that reminds you to breathe and gives you like little affirmation quotes. So it'll be like a pop-up on your phone. An iWatch, I've heard, also has a buzzer or vibration that'll tell you to breathe if you set it up.
My husband has that. It's really fun. He has that. It goes, it vibrates, and it's really nice. It kind of breathes with you for like a minute or 2 minutes. It's really nice.
Awesome.
Yeah.
HeartMath is another good tool. HeartMath is actually, you can put an app, you can download the software onto your phone, and it uses your heart rate rhythm variability to detect and to really train your parasympathetic nervous system. So how I would use these things is, again, identifying when you know, it's a reflection. You have to know, like, okay, if my boss says this to me, this is how I normally would respond and it would piss me off. Okay, if he comes up to me, I'm going to remember to breathe. Like, it's just remembering, like, what sets you off, what ticks you off, what usually gets under your skin. Again, it could not just your boss example, but traffic. Sitting in traffic sucks. Everyone is in traffic, knowing the fact that you're not alone and just saying, well, I can't really do anything about it. I can either be pissed off or I can breathe and have a peaceful mind in traffic. Because it's not going to change with you being angry, right? Yeah. It's just not.
That's so true. That's great. I love that. I can identify with that one actually. or probably, sex. I mean, sex of course is going to be a triggering experience for somebody with pelvic pain. So maybe before sexual activity, they can take some time.
Yes, and foreplay. So I would say being comfortable, that's a whole nother dynamic and I think a topic on its own. But if sex is a trigger, especially for women with dyspareunia or vaginismus, dyspareunia is just pain with intercourse or penetration in general. But if that freaks you out, I think having multiple support systems to help you, again, psychologically as a cognitive behavioral training, just to lessen the experience of having it associated with a negative thing. So flipping the script, right? What's positive about having intimacy? And do you really have to have penile vaginal penetration? Can you have intimacy and have an orgasm and pleasure without experiencing or pushing your boundaries to that pain, and then again creating that vicious cycle of, it hurts, I'm associating with it a negative thing, and then it's just feeding that feedback loop. So I think exploring and communication is very important between the partners. I think communication is huge, and if you can be open about it, that even lessens your stress. Just being able to be open with someone and say, hey, that just doesn't feel good today. Like, for example, for me, if my husband and I are being intimate and I'm just, my urethra is kind of irritated, I'm having one of those moments and it's flared up, I just say, can we do something else? Or I think this will feel better if you rub my belly or do some soft tissue work or massage. And it kind of like creates more of a positive experience around the whole thing versus a negative. So you're cultivating and actually planting a positive seed and then getting rid of the weeds.
Yeah, that's awesome. I love that. I'm glad we went there because, that's a huge topic. So we have this first one, your RRE. Yes, RRE. And then, excuse me, what was that? I think we got everything on that one. Was there another tip that you had?
Well, the E is for eliminate or eradicate. So you recognize, reduce, and eliminate. But the elimination will happen as you practice recognition or awareness and then reducing whatever you want to reduce, whether it's a negative thought or pain association or something like that. So eventually, if you practice really hard at doing the first two, the R and the R, the E will come naturally to the point where you just won't even pay attention anymore and you're living your life pretty much. I like those things. And practicality purposes, stretching, breathing, pelvic floor really relaxes with deep breathing as well. I didn't touch base on that, but your diaphragm and your pelvic floor, they work together. So, as you take a deep breath in, the pelvic floor lengthens and elongates. And then as you exhale, it comes back. So you want to, when you're doing your diaphragmatic breathing, not only are you stimulating your parasympathetic nervous system, but you're also mobilizing the pelvic floor. Yeah. and you're creating less tension. Doing a deep yoga squat. You're the yogi. I like the deep yogi squat where the feet are planted, the knees are wide, or you can modify that by doing a baby pose. What is that pose? The baby pose?
Oh, happy baby.
Happy baby pose.
It's like where your legs are up in the air and yeah.
Yeah. You're just like breathing. And again, the concept of using diaphragmatic breathing with a pelvic floor awareness is really going to go a long way, because what you should feel is the tailbone lengthening, your anus or the vagina or the areas around the base of the penis and the urethra should feel open and a slight bulge. And then just breathe. And wherever you feel tension, acknowledge, don't resist. I wouldn't try to change anything. I would just accept it and breathe and use the breath, and you'll see that automatically the tension will decrease. Now, it won't be like, oh, I have a weight in my hand and I'm putting it down. It won't be that drastic of a feeling, because the muscles are so tiny. Mm-hmm. So the range of motion it does require some brain connection and awareness and quiet time to like really feel it. And once you get good at it, and once the connection is made, you can do this anywhere. Yeah. Sitting in your car, at the grocery store, because you feel yourself tense because this lady's taking like 10 minutes, like that sort of thing. And you can just pretty much apply. And I do that in my daily life. And it's like a normal thing for me now, because I can pick up on when my body just doesn't feel good. Yeah. And I just take a moment to breathe, and I'm like, oh, why am I clenching my ass right now? Like, what is that all about? Like, that's not necessary,
Everyone should do a check right now. It's like, see if you're clenching your ass right now, because it's so true. That's just that thought. I've had it many times. It's like, oh my gosh, I really am clenching down there, and I don't even know why. Or like, think to yourself, okay, have I breathed in the last like 5 minutes? I mean, obviously you're exchanging oxygen to live, exchanging air, but you're not necessarily breathing. So yeah, I love that.
You're exchanging it on a more superficial level versus more of like that deep breath is actually creating the oxygenation of that blood, improving that is that diaphragmatic breath. Oh yeah.
And like you said, that mobility of the pelvic floor when you're breathing, it is kind of like giving yourself an internal massage, because you're moving the tissues so nicely. So okay, awesome. So we have breathing. What else? Do you have anything else that you can share with people? And then maybe we could briefly go into, if they are going to see a physical therapist, what to expect.
Ooh, what else? Have fun. Have fun, laugh. When was the last time you had a bit, belly laugh? Because with pelvic pain, it's frustrating and oftentimes isolating. So I think just having fun, despite the circumstances, it will again cultivate more of a positive experience and lessen and distract you from, catastrophizing or ruminating on what's happening in your body. So having fun, laugh. Don't wait for the pain to go away to live your life. Live it today in the now.
Yeah, I so agree with that, and I think it can be hard for some folks with chronic pain issues, because it's so tiring and exhausting and disheartening to feel, as we talked about early, that nobody's taking you seriously, because it does get to that point. So I know that one's probably hard for maybe some people to hear and do, but I agree with you. It's like just lightening up a little bit will take some of the tension off in itself, and that will help decrease that sympathetic reaction and kind of downregulate and soften things.
Exactly. Yeah. It's all connected, like you said earlier, Bri.
Yeah, it's all connected. Okay, awesome. So have fun, breathe, identify your triggers, diffuse them, and then eliminate them because you're using your tools. That's awesome. Is there anything else that you want to throw into that mix before we?
No, we covered stretching a little bit, like a deep yoga squat or the happy baby pose. Yoga is a very, very wonderful tool, and you're spreading the word very nicely.
I know, and I have an excellent series coming up about yoga for beginners, so that's coming to YouTube. So please keep an eye on my channel. And so if somebody is going to maybe seek out a women's health physical therapist or physiotherapist, depending on where you are in the world, first of all, I want to say that I know that many men sometimes are like, I I don't know where to go because they're called women's health physical therapists. Like what's the deal with that? And I know that some men feel very awkward contacting a women's health physio, but first of all, they can also be called pelvic floor physical therapists or pelvic floor physios. I think that's a better term. And you can, do an online search. There's a link to a search, an APTA link tool that I can put in the video notes below. But maybe you can give some sort of advice there about how to find one and also what to expect.
Right. Great question. So since you talked about guys and that whole situation with guys experiencing really a lack of, I think, support in that aspect, because you're right, everything is women's health, and you're absolutely right as well. It should be pelvic health therapy or pelvic floor physical therapy, not women's health, because certainly there are over 2 million men in the U.S. alone that go to outpatient clinics just for pelvic pain related issues.
Really?
So it's a huge, and that's probably underreported because let's get real, guys don't talk about their penises to their friends. They're not talking about it in the locker room, right? Hey, my penis hurts today. How's yours? Like it's just not a talk that and guys in general, just it's been in the literature and it's a stat. They just don't go to the doctor, and then if they do, well, who do they go to, right? Like we have a gynecologist we can see that deals with our reproductive organs, but for guys, who do they see? And oftentimes they'll go see the internist once it gets really bad, and the internist has no idea, and they'll just give them antibiotics and be like, oh, come see me in like 8 weeks. You should be fine.
Yeah.
Nope, it doesn't. It doesn't be fine, and then they're on more antibiotics, and then it's a vicious cycle. So by that time, now you've got psychosexual component because now they're freaking out that they're just not catching something, and it's just terrible. So yes, you're right. I think that we need to spread the word about there are therapists, female and male, believe it or not. I've actually had 2 reach out to me in the past couple months who are, there's one in Georgia actually, there's one in New York, who are new grads from physical therapy, men who experience pelvic pain themselves, and now want to help treat men.
Wow, that's great.
Yes,
that's wonderful to hear. Yeah.
Yes, there's also a therapist in Asheville, a male therapist who actually does work with male clients for pelvic health related issues.
Great.
And they can also take the courses that I took to become certified. Men therapists are all welcome to take those courses and become certified as well. So it's growing. The awareness is growing and the word is spreading. And I think to find a good therapist is word of mouth is the best, to be honest. Yeah. And not to say, and I'm going to say a disclaimer because I practice differently. I'm very open. I will touch the penis. I touch the testicles. I'm not afraid to go down there. It's okay if you get a boner, like not a big deal, that sort of thing. A lot of men that come into my office, oftentimes the first thing they'll say is, I had to hold my genitals out of the way. We just did not go there. And they are very surprised that the way that I approach it is like, it's not a big deal. Like you have genitals. We need to take a look at them. It's not embarrassing. You should not be ashamed. Okay, that's the thing that bugs me. It's like you should not be ashamed to be a man and expose your genitals, even if it's a woman. It's a professional relationship. It's a whole different. And I think nurturing them and they just want to feel loved and supported and listened to, and they're just not getting that. So there are therapists who are females that are, and again, it's okay. Everyone's got their comfort level by all means, and they're doing their best to help as much as they can. But some of them just don't go there either. Yeah. And I think knowing when you go see a pelvic therapist, that if they're not really working the outside of your penis and their balls and all of that, and they're not looking at that, and they're just doing biofeedback or just internal and completely avoiding that area, I would get a second opinion maybe.
Yeah. And even just backing up a step from this, some people's minds might have just gone, like, what is she talking about? Because I think that the entry point of what I want to get at here too is that this is what happens in pelvic floor physical therapy for males and females is in most cases, and like you're saying, in some cases, some therapists will only do external kind of like maybe releasing your inner thigh muscles or working on your low back tissues and your gluteal butt muscles. But most of the time, if you're going to a pelvic floor physical therapist, there's going to be an internal intravaginal or intrarectal exam done.
Correct.
And so maybe people don't know that. So.
Correct. Oh, you're right. You're totally right. And my bad, because I'm used to.
No, I know. It's like you're there. You're in the thick of it.
Sorry. Yeah, I am. I mean, yeah. But you're totally right. And but doesn't have to be. So that's another thing that people are like, oh my God, they got to put their finger where. No. It doesn't have to be. And you don't have. I'm never a believer of forcing someone to do something out of their will, even if it's for the sake of like. Oh, I have to do that because I need to know what's going on. I mean, as a therapist, you should be able to extrapolate enough information to help a person without having to do something that makes them squeamish or creates more of a negative connotation or a negative relationship to what you're doing. But the last thing you want to do is be another danger for someone,
For sure.
And a lot of times they've already been poked and prodded in cystoscopies and vaginal ultrasounds and biopsies and you name it. I mean, they've gone through a lot. And I feel like the last thing that they want from you is to be that another trauma or another danger. So I think that's worth saying.
For sure. And so that's actually probably good for someone to know that if they know they're not going to be comfortable with that, then to feel out their physical therapist beforehand or just say it up front and not to hold back and like be like, oh, this is what I have to do and I don't want to do it. You should just be vocal.
And therapists should ask, because I just had this the other day with a gentleman who was like, you can tell in his body that he was just like, as I was explaining the process, he was just so scared. He had this look on his face like, oh my God, I don't know if I want to do this. And I said, how are you feeling about all this? And he said, I'm so glad you asked because I'm really nervous. And I said, tell me what's nervous about this whole thing. And he's just like, I'm nervous that you're going to look at, that you have to touch my penis and my testicles. I've never had such a thorough examination before. Mm-hmm. And then you reassure them and say, by all means, you're in control of your body. If something doesn't feel right and if you're not comfortable, that is entirely up to you and we stop. Mm-hmm. It takes the pressure off of them. It makes them know that you are aware of their vulnerabilities. And for males and females too, some females just don't like it either and they just get really squeamish and you work around their needs and where they're at right there in that moment with you and then you build rapport and trust. So that dynamic is super important for healing.
Yeah, for sure. I mean, you're not going to get anywhere as a patient if you're not communicating with your provider, and then, your provider should know this as well. So
yeah.
Okay, that's great. I'm glad that we were able to share that information.
Yes, it might be TMI. I'm sorry, guys. Guys and gals, sorry.
No, it's so good. And this is what people need to know, and this is what we need to talk about. And not to make it sound like it's scary or anything, because really, from my experience, and it's been a while since I've been in the clinic, so I'm really going to let you take over here we have a few minutes left. Just sort of the process usually involves, looking at the body, looking at the posture, and looking at the muscles and strength and that kind of thing, but then doing an exam of the pelvic floor muscles, and that's what we were just talking about. A good way to access them is internally. And then what else am I missing? What else would somebody maybe need to expect or prepare for?
I guess it depends on who they're seeing. I think because I'm a little integrative, I practice functional medicine as well. So I take my clients through like a health map, and I not only discuss the physical part, but to expect discussing psychological components and dietary and nutritional aspects that might contribute to what's going on in the overall picture, and also from a physical exam standpoint, like visceral mobilization and looking at how the bladder is moving nicely and the uterus and the rectum and all the inside of the container per se in terms of the musculoskeletal side, and not forgetting that and the fascial connections to the musculoskeletal system. So I think they should expect an overall very thorough, comprehensive assessment looking at them as a whole, and not just a body part.
Yeah, that's wonderful. I want to go see you. If I need to go see a women's health physical therapist, I'm seeing you, Susie.
Oh, thank you.
It sounds like you do a wonderful job. So let's in respect of everyone's time, we'll wrap this up. But I want to let people know how they can connect with you if they have questions. I also want to share about your new book that's coming up and just how people can learn more.
Sure. Thank you so much. Yeah, you guys can connect with me at drsusieg.com, drsusieg.com.
And I'll put all the links in the notes below, so I'm just going to write them down. But yeah, I'll put them.
Thanks. Thanks, Bri. Yeah, and so there's a Work With Me section, and I have an online program coming out, men's DIY pelvic pain relief program. That's at home, kind of go at your own pace, how to assess and treat your own pelvic pain. And you're right, my book, oh my gosh, it's here, it's in the print.
Oh, that's so exciting.
I got it yesterday.
That's amazing.
Yes, I'm so excited. It is my fruition is actually in physical my hands right now, so it's an illustrated manual, a dude's manual for men and how they can navigate, a no bullshit guide to helping you navigate through pelvic pain.
That is so great. Yes.
Thank you.
Yes.
Yeah.
So needed. Yeah.
Thank you.
That's great. So people will be able to find it by way of your website, and we'll put those links below. So that's wonderful. Do you see people just in person or online as well?
Online as well. So great. A lot of time, online as well. There's consultations that we can do and all the things. So for sure.
Okay, great. Well, thank you so much. I really think we covered a lot here today. So I really appreciate your time, and thank you everyone for watching. And as always, eat clean, move every day, shine brighter, right? Yeah.
That's right.
Bye,
Thank
Susie.
you.
Bye, everyone.
Thank you.